Hi everyone, welcome back to my YouTube channel and today we are going to talk about thrombosis. So let's start our topic with introduction. Thrombosis is a serious medical condition in which a blood clot forms inside the blood vessels or the heart. The clot can obstruct blood flow or at its side or break loose and travel to other parts of body, causing life-threatening complications such as stroke, pulmonary embolism or heart attack. Definition of thrombosis. Thrombosis is defined as a pathological formation of blood clot within a vein, artery, or cardiac chamber, leading to partial or complete obstruction of blood flow. Types of thrombosis include venous thrombosis, arterial thrombosis, and other specific types. Venous thrombosis occurs in veins and most commonly as deep vein thrombosis in legs or pelvic. Arterial thrombosis occur in artery and often leading to myocardial infarction or ischemic stroke. Other specific types include portal venous thrombosis, cerebral venous sinus thrombosis, and retinal venous thrombosis. Causes and risk factor of thrombosis. First is Virchow Triad. There are three main factors are endothelial injury, stasis of blood flow, and hypercoagulability that increase the chances of thrombosis. Second is medical conditions like cancer, obesity, diabetes, and atherosclerosis increase the chances of thrombosis. Third is lifestyle factors like smoking, prolonged immobility, and dehydration. Fourth risk factors include medications like hormonal contraceptives and hormone replacement therapy. And fifth is genetic disorders like thrombophilia and factor V Leiden mutation. Pathogenesis of thrombosis. Thrombosis develops when platelets and fibrin aggregate at the site of vascular injury or abnormal blood flow. They lead to clot formation which may remain localized or embolized to distant sites. Clinical features of thrombosis. First is venous thrombosis. Venous thrombosis can cause swelling, pain, warmth, and redness in affected limb. Then there is arterial thrombosis that can cause sudden severe pain, pallor, coldness, and loss of function in affected area. Then we will talk about complications of thrombosis as they may cause pulmonary embolism, stroke, or myocardial infarction. Diagnosis of thrombosis. First, we can do imaging that may include Doppler ultrasound, CT angiography, or MRI. Then we can do is blood test in which we check D-dimer level and coagulation profile. Then we can do clinical examination that is for the assessment of limb swelling, tenderness, and vascular status. Management of thrombosis. First step is medication. We can give anticoagulants like heparin, warfarin, and we can also give antiplatelet drugs. We can do thrombolysis, that is use of clot dissolving agent in severe cases. Third, we can do is surgical option, that is thrombectomy or placement of fibers in major vein, filters in major vein. Fourth, we can do is supportive care, that is includes compression stocking and lifestyle modification. Prevention of thrombosis. First, regular physical activity and avoidance of prolonged immobility. Second, we can prevent by adequate hydration. Third, by smoking cessation it can be prevented. Fourth, by prophylactic anticoagulation in high risk patient like in patient with post surgery or with cancer therapy is given for to avoid the risk or to prevent the thrombosis. Conclusion of this lecture video. Thrombosis is a potentially life-threatening condition that requires early recognition and prompt management. Understanding its causes, types, and preventive strategies is essential for reducing morbidity and mortality. And this was all about thrombosis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.